Hello class, we are going to take a look at the structures of the muscular system that you are going to be responsible for identifying for your skeletal system practical. The images that we're going to go through are going to be images on a cadaver. Please expect that many of the images that you'll be shown on your practical will be on the cadaver. There may also be some muscular structures that are demonstrated on or shown on models or pictures. First muscle to identify is, well, first of all, we're looking at an anterior view of the head and neck. First muscle to identify is the orbicularis oculi. So the first word, or orbicularis, tells us the circular shaped muscle. Orb is a circle. Oculi tells us the location. It's going to be in the eye region. So here, highlighted in purple, we see the orbicularis oculi. I'm going to take the highlight off so you can see it. It's a circular shaped muscle, surrounds the eyes, allows you to close the eyelids. The next muscle is orbicularis oris. Again, orb tells us it's a circular shaped muscle. Oris means around the mouth. So here, highlighted in purple, we can see the orbicularis oris. Again, I'll take the highlight off so we can see it's a very fine circular shaped muscle, allows you to purse or to pucker the lips. The next muscle to identify is the masseter. To see this clearly, we need to see a lateral view of the head and the neck, so we're going to change to a lateral view. Masseter is one of our two very powerful muscles of mastication or chewing, and here highlighted in purple we see the masseter. If you were to bite down and kind of bite your teeth together, a muscle that would bulge out laterally in the cheek area is the masseter. Again, I'll take the highlight off so that we can see the masseter here. The kind of component or the complementary muscle to the masseter is known as the temporalis muscle, and that's this large kind of fan-shaped muscle that sits over the temporal bone of the skull. Again, this is also a muscle that's used in mastication. I'll highlight it for you. That's still the masseter. Let's move to the temporalis. So here's highlighted the temporalis. You can see it here attached to the mandible. Helps in mastication or chewing. The next muscle to identify is the zygomaticus. Here we'll identify the zygomaticus in purple. Attaches to the zygomatic bone and also to the upper angle of the mouth. When this muscle contracts, it helps lift the mouth up, and it's one of your muscles of facial expression for smiling. Next muscle to identify, we're going to look at this muscle both in a lateral view as well as an anterior view, is the sternocleidomastoid muscle, and that's this kind of oblique running muscle. Here it makes up a majority of the musculature of the neck. Its attachment points here we can see is the mastoid process of the temporal bone. It comes down and attaches to the clavicle and to the sternum. Let's go ahead and take a look at this muscle in an anterior view. So again, the sternocleidomastoid muscle, we see that here, large anterior muscle of the neck. Next muscle to identify is the splenius capitis and then the levator scapulae. Both of those muscles we're going to see best with a posterior view. So we are going to go ahead and take a posterior view and look first at the splenius capitis. Splenius capitis, kind of a very broad strap-like muscle that attaches to the cervical spine and also to the base of the skull, allows you to extend your cervical spine. We'll take the highlight off so we can see that muscle a little bit better. Next muscle is the levator scapulae. Again, we'll highlight it initially and then take the highlight off. Here's the levator scapulae here. Levator tells us that it's involved in raising or elevating, and the scapulae refers to the scapula. So this muscle is attached to the scapula. When it contracts, it helps to elevate the scapula. We'll go ahead and take the highlight off so we can see that muscle without the highlight.